Hi, my name is Anthony Reyes. I'm the president of the High Technology Crime Investigation Association. It was formed in 1989, basically to help in the prevention and investigation and prosecution of high technology crimes. Made up mainly of law enforcement, and then later on private sector and academia was added. We're responsible for investigating some pretty famous crimes, and things like the BTK killer case with Dennis Rader, Scott Peterson and Lacey Peterson case. One of our members had grabbed information about the computers that helped the prosecution in that case, 9/11, and other cases that you've probably heard about. Additionally, we spend a lot of time protecting children online. We do online investigations for pedophilia, frauds, and scams. And we're the oldest and probably one of the most respected organizations in the high-tech crime investigations arena. We're not just a U.S.-centric organization. We have chapters around the world, and we have partners around the world. We collaborate and network. We get together every year. We have a huge conference. We figure out what the trends are in cyber crimes, and we try to get together and come up with some sort of plan for what the future is going to be and how we can tackle these technical crimes. One of the reasons why you should think about joining HTCI is because we share resources, we network together, we push ideas off one another when there's a new technology on how to investigate or how to best utilize technology to help us in our investigations. It's a very unique organization. Most of the time we're always talking to each other, we're referring cases, we're asking for contacts. And for smaller police departments that don't have the kind of resources, you can kind of crowd investigate, kind of crowdsource investigation by tapping into the network that exists. It's a really unique organization. It's one of the oldest and most prestigious in the world for high-tech crime investigations. I hope you'll take a look at us. I hope you come and look at our conference and find out what we're all about. I look forward to seeing you.
We've all felt that adrenaline when we hear them coming. It can be anything from a routine speeding ticket to a grave and dangerous situation unfolding right before our eyes.
All back units in 4071, 4071 and 211 just occurred, New Jersey and Savannah, New Jersey and Savannah. Suspects are armed with a handgun. They're described as 3 male Caucasians, all wearing white shirts.
But what you often don't see is the life-threatening risk that police investigators and digital forensic practitioners encounter when handling contaminated evidence.
Unfortunately, there was no set protocol. There wasn't a lot of research in that field at that time when I was handling digital evidence for the department that I was working for. So we would come up with our own methods just to protect ourselves, such as placing the phone inside of a plastic Ziploc bag while we were interrogating it, and of course wearing gloves and things like that, just to keep us protected.
Located on the north side of James Springs, Ohio, inside this suburban garage, everything needed to make meth. Everyday items and strong acids, the raw chemicals needed for a meth lab, are extremely volatile.
We've heard from agencies around the world that are struggling with this specific problem. And what we often hear is that when they encounter a device they know has been exposed to hazardous conditions, a couple of things may happen. They may put it on a shelf in an evidence locker, waiting for the right technique to emerge of how to clean this in a safe way and still retrieve the evidence. We've also heard situations where agencies just simply refuse to take digital evidence in that has been exposed to certain classes of chemicals and biohazardous conditions. And if you think about that, these are digital devices that could help solve investigations, but the risk is so high in addressing them that an agency may choose to simply not touch that device for the risk that it could be to their laboratory personnel because they don't have a good way to decontaminate the devices.
When I was a detective, as a homicide investigator, we're constantly having to deal with devices that have different types of biohazard. There's a lot of things that you don't even see. There are synthetic narcotics out in the public today that just upon touch can lead to death.
Hello, my name is Steve Watson. I'm with VTO Labs, and I'm very excited to be with you today to be talking about the decontamination of electronic evidence. This is an area that has needed guidance for some time for digital forensic practitioners, and I'm so glad that so many of you chose to spend some time today to learn a bit more about this topic. 38 countries represented today and the people that signed up for it. So we really appreciate you being here and learning a bit more about this. I have one goal from this presentation today. And what my hope is that when you walk away from this, you will understand that you will have a heightened awareness of the biohazard risks that you may encounter as a digital forensics practitioner. That we're going to talk about a number of things as we go through this, but I want you to be safe as you're going through your daily practice and working through investigations and solving cases. We have three parts to the presentation as we go through. Number one, what is the risk and why is this a risk? Second part, we'll be talking about how to clean electronic devices, because this is something we frequently get this question about of how can we clean it? What can we do without hurting the evidence? And then the third is a proposed solution for you on how you in your lab can decontaminate devices that have been exposed to biohazardous conditions. The first thing I want to bring out, it's helpful anytime we're talking about a topic to make sure that we all have the same understanding. And the first thing to identify is, what is a biohazard? And two different definitions here. Webster's dictionary says a biohazard is a biological agent or condition that is hazard to humans or the environment. We see a second definition here, something such as a disease or a chemical that may harm people, animals, or the environment. And that's really the key issue, is how can we identify what these risks are and engage the appropriate techniques on how to address it. Why are we talking about this? Why is this an issue? And those of you that work in this area, particularly in law enforcement agencies, you know that you may encounter evidence coming from a variety of different kinds of conditions. The scenes you see here on the screen are not uncommon of what we may encounter, and devices coming out of this environment brought to us that then we're supposed to get the data off of these devices. If we look at what traditional crime scene collection uses to protect themselves, we can see several examples on the screen here of people wearing appropriate PPE. Sometimes they have masks, they have eye protection over their eyes, complete suits. And yet, if we then turn and look at how a lot of our digital forensic labs look, we don't see that same heightened level of personal protection on the users, because we're so focused on getting that data off. The types of hazards that digital forensics personnel may encounter include some of these and maybe even more: blood, saliva, fecal matter, other kinds of body fluids that may be on the devices we're touching, viruses, bacteria, decomposing flesh. Some of you may be supporting agencies that are dealing with narcotics, and that could be a risky residue that's on the devices, biological agents, flammable liquids, caustic liquids, and different kinds of chemicals. There's probably even other things that you've encountered, or somebody's handed you a device before and you think, is this even safe to touch? The problem statement when we think about this problem is that despite having well-known procedures and practices in crime scene investigation and wet forensics labs, digital forensics labs and the practitioners, we often neglect the PPE, personal protective equipment, safe handling that we need to when we're touching these devices. And we may have no viable option on how to clean them. Somebody may bring you a device that you really don't have a way to clean this off. So this is something that we need to figure out how we can solve. Questions that I get from this problem statement is, why is there that discrepancy? Why do we see one standard that's commonly used for the crime scene collection people that are on site, and between them and the digital forensics people, and how do we change that problem? How do we change this for digital forensic practitioners? One of the things that I think is really important is we understand why this is a problem. If we look to Locard's principle of exchange, and those of you that have studied forensic science or digital forensics in university, you're familiar with this, that every contact with a crime scene leaves traces at the scene and takes traces away. And you can see in the example of the photo here on the screen is that there's a bloody footprint on this tile. And if you think if somebody came onto a crime scene and was not wearing the appropriate equipment, did not know the rules of engaging on a crime scene and introduced additional bloody footprints, you could say, was that there when the crime happened or shortly after, or did somebody else bring that on? And that's the core principle of this is every time a human interacts with a crime scene, or I would submit to you, even with digital evidence, there's that risk that traces can be left. And how do we address that? Why is this an issue? I've got several different publications here to share with you. This is a U.S. Department of Justice, National Institute of Justice report on crime scene investigations. And you can see here in this quote, it talks about the personal protective equipment at the top. But the highlighted part is that you wear this stuff primarily to avoid contamination of the crime scene. We have another document here, forensic science regulator out of the UK on dealing with crime scene investigation. And you see personal protective equipment here serves that dual purpose, protecting the wearer, but also protecting the exhibits from contamination. So we're starting to see a theme emerge among the guidance that we have. Here's another one, North Ireland Police Services for serious crime scenes. And why do we wear this personal protective equipment and be cautious to ensure that the risk of potential cross-contamination is considered and minimized? As we keep thinking through this, we see not only the guidance from the law enforcement organizations and the regulatory bodies, and we start to shift to the popular publications that address our discipline. This is laboratory equipment. It's a website online, and we can see a quote here where a defense attorney had asked if I wore gloves during the analysis to prevent cross-contamination. I thought about my response for a moment and then acknowledged that, yes, that was part of the reason. So not only did the person probably not want to cross-contaminate the evidence, he didn't want to touch it and get it on his hands and take it home to his family either. Another example from Lab Manager, PPE is our last defense because it means the hazard is actually at hand, and without PPE, hazard exposure or injury may very likely occur. Another example, this one, and those of you that are in law enforcement in active roles, you know the risk that opioids and synthetic opioids have introduced to our colleagues in recent years. And this says opioids put first responders at risk. And we've all heard those stories of law enforcement personnel responding to a crime scene and inadvertently getting contaminated with fentanyl or something that's very, very dangerous, and the risk of overdoses there. Fentanyl isn't just deadly for the drug users. Police are getting sickened. And what I submit to you today is if we realize that crime scene investigators and those that are responding on the scene may encounter this, those devices that people dress up in full white suits and covered faces to deal with, as those work their way through the process, they eventually get to you and me. And we don't know what's on this device that we may need to clean off before we can safely interact with it. If we look at the evidence flow of what happens in most law enforcement agencies, and we think of those as teams or processes, the very first step often is that crime scene investigation. And we're used to seeing the way crime scene investigators will protect themselves when they're on scene in a risky situation. The evidence also moves from there to trace or wet forensics, where they want to capture fingerprint, DNA, saliva, any of the traditional forensic science techniques that we need to do while the evidence is still fresh. And then lastly, it shifts to digital forensics. If we think about these processes and the teams involved, there's two different areas of risk to comprehend. And in each one of these, we see that there's an evidence contact risk. The crime scene investigation, if they inadvertently touch something or introduce DNA to the scene, if they introduce other things that could affect whether or not, was that evidence that was on the scene before we arrived on scene? The trace and wet forensics people, they do the same thing. They cover themselves in the right personal protective equipment, so they're not introducing their own hair, saliva, DNA, skin samples into the technique. But the risk, the evidence contact risk, is very different when we talk about digital forensics, because our focus is not on what's on the surface of this device. It's the data inside, and it's that risk of data alteration that is super heightened awareness to us. This is why we interact with the data the way we do. We use write blockers so that we don't leave artifacts on the devices. So the evidence contact risk, each of these categories have an evidence contact risk. It's different for digital forensics. However, the health and safety risk is identical for all of them. The same people that are on scene touching a device that may be contaminated, that gets handed to the trace and wet forensics people who still have that same risk for a device that's contaminated. It then gets passed to the digital forensics people, who may not even be aware the device has a biohazard risk associated with it, and they still have that same risk of if they come in contact with this device. As we think through this, we see a very big discrepancy for those of us that work in digital forensics, that our evidence contact risk is focused on the data, and yet the risk to us as individuals is that if we touch it and there are biohazardous conditions on it, it could be damaging to us. It's this laser focus that the digital forensic examiner has on we're so focused on, we need to get the data, we need to be careful in how we interact with it, that you and I may miss that personal protection step of being cautious and careful of what's on the device. This reminds me, just a couple of years ago, one of the team members at VTO was traveling to a different location to do some research testing with a set of devices, and it was a same day trip, so we needed to get there and get back on the same day. So we just had carry-on luggage with us. We weren't checking bags. And my teammate was carrying 10 phones, 10 sample phones that we were going to be doing for some damaged device testing that we encountered. As he went through airport security, they pulled him aside, said, why do you have 10 phones in this bag? He explained to them what VTO Labs is and how we test devices for digital evidence. And they said, because he was pulled aside, they needed to do a random drug screen on these phones. These are phones that had been in our facility for months that we had set aside to use for testing. And of the 10 phones that my colleague was carrying through this airport to go to another place, 8 of those 10 phones tested positive for cocaine. And this was really a reminder to us that we don't know the origin of these devices. We don't know what they've been exposed to. And so if we're picking those up and touching those, and they have something like cocaine or even something that potentially could be more deadly quicker, we need to be aware of that and treat every evidence with that same caution. Why does this matter? It matters for 2 reasons. And the reason it matters is that it affects people you know. It affects the colleagues that you're working side by side with. If you as a digital forensics practitioner are somehow affected or infected with this, I don't want you taking this home to your family. I don't want you to be at risk or the people that you love to be at risk. The second reason it matters is that evidence may not be addressed because someone doesn't know what to do. I've heard of labs all over the world that they get a phone in that's covered in blood and they say, I don't know how to clean it. I don't want to touch it. And so there may be evidence that we're excluding from cases because the risk is so high, we're afraid to touch it. If you look at VTO Labs, we deal with these scenarios all the time. And on the screen, you can see just one of the blood covered device studies that we've done where we have devices that are covered in blood so that we can figure out the right way to clean those so that you can still get the data off of them. Another just recent example this week is that a colleague of mine, one of the people on my team was with me on a scene. We were processing data to get data out of a car, pull the vehicle modules out of a car. And I pointed to him and I said, look up above you on the ceiling. And this is what was on the ceiling above him. The reason this is important, what you see on the ceiling above him is actually brain matter from someone that had perished in this accident. And so we never know as digital forensic practitioners when we're going to encounter a situation that that biohazard risk could be cautious. We don't know what risks are associated with that particular stain on that ceiling, but we better be aware and ready as practitioners to know what to do to address these situations. Over the last few years, as we've tried to comprehend this area, there was one military forensics lab that it's an escalation lab. So there's digital evidence processed at regional labs. And if something's really hard, it gets pushed up to these other labs. And I asked them, what do you do? What do you do when you receive a device that's been covered with biohazardous material? And they said, we simply turn down any devices that have been exposed to blood or any human fluids. They just say we're not doing it. A very senior escalation lab. For me, as someone that works in this space, that feels like a problem that needs to be solved, and it feels like something that we need to determine how to address, so that we're not excluding evidence that may be important to our investigations just because this biohazard risk exists. One of the principles that I want to introduce you to is something that comes from medicine, and it's a principle that's called Universal Precautions. And you can see a quote here from a Bloodborne Pathogens standard in the United States that says, Universal Precautions is an approach to infection control. And as I skip through, it says all human blood and certain human bodies are treated as if known to be infectious. And what this means is that for universal precautions in the medical community, if they see blood, they automatically assume that it could be hazardous to them, and they would wear the right personal protection to prevent them from getting anything on themselves. My interpretation of this and how this applies to digital forensics is that we treat every piece of evidence as if it may have been exposed to biohazardous conditions. And one example of how that works in our lab is that we don't touch devices without gloves on, at a minimum, because we don't know where that device has been. We don't know the history of it. And even sometimes when we ask a partner agency, has this been exposed to biohazardous conditions? Often the answer is, I don't know. And that's enough for us that we employ universal precautions in our laboratory to ensure that we can keep our personnel safe. If we look at a definition of bloodborne pathogens, and this is from that same OSHA document, bloodborne pathogens means pathogenic microorganisms that are present in human blood and can cause disease in humans. And you see a couple of examples in this quote: hepatitis B, human immunodeficiency virus. But depending on where you are in the world, you may have other kinds of bloodborne pathogens that are at risk for the evidence that you're interacting with. The important thing is that we, as digital forensic practitioners, we need to be aware of what the right personal protective equipment is. And you've heard me say a few times in the presentation so far, PPE, personal protective equipment. And this is the same thing they would wear on a crime scene. It's gloves, it's eye protections, it may be a mask, although all of us are used to wearing masks over the last year. It may be a clothing cover or a lab coat that covers you. The basic principle of personal protective equipment is you cover the area of potential exposure. So if you're dealing with something that may get into your eye, you cover your eyes. If there's something that you may be able to inhale, you're covering your face with a mask. Or as the risk increases, you may be even shifting to more comprehensive respirators, like you see on some of the crime scene photos we've seen. Decontamination challenge. And we're based in the US, so we often look to the regulations here to understand these problems. And the same bloodborne pathogen standard that we've been talking about so far, the bloodborne pathogen standard requires that any item or surface contaminated with blood or potentially infectious materials should be decontaminated with an appropriate disinfectant. For those of you that are in the US, this standard, we should realize that this standard may apply to our laboratories as well. If you encounter a device that you know has been exposed to these, it's within the realm of reason that this OSHA standard could be applicable to our labs as well. So what is an appropriate disinfectant that we can use to clean these devices with? Here on the screen, you can see a EPA registered tuberculosidal disinfectant. And the thing that's interesting about this is that the thing that's most important to me as someone that works on electronics is that the pH of 11 to 13 is what this particular disinfectant is measured at. And this is extremely alkaline on the pH scale. The reason that's important is that alkaline solutions are the most damaging to electronic devices. We can have solutions at VTO Labs. We do a lot of work in damaged devices and devices that have been under all kinds of liquids. And we have found that solutions that are alkaline are more devastating to the circuit board and the chips than a solution that is acidic. So the recommended solution for this problem for bloodborne pathogens would damage the evidence, which we don't want to do. A few best practices for handling, and then let's talk about how to clean electronic devices. This might be a useful thing for you to grab a photo with your phone, perhaps see the video later, or if you want the slides, email me at the end of the presentation. I'm happy to share slides with you as well. But number one, ask your lab intake to add a field on the form to identify, has this been exposed to any biohazardous material? The intake form that we have at VTO Labs, we ask this question explicitly because we get a lot of devices that have been exposed to bad things. So this is something that you should consider adding to your intake forms as well. Number two, practice universal precautions. Expect that every device has pathogens on it. If you even think in your home and your friends and all the places that they take a phone, they may take phones to places that we don't necessarily want to touch it until it's been cleaned. If you extrapolate that even further out to other people and evidence that we may be receiving, we don't know what's on this phone. Number three, wear the appropriate PPE. And this is something when I talk to lab managers around the world, I emphasize to them, your lab needs to pay for personal protective equipment for your employees. Lab managers that are on here, if you don't have that in budget, that's something you really need to reach out to your management and help emphasize. The same way this is important for crime scene investigators and the wet forensic teams, you need the right equipment to protect your digital forensics people as well. Number four, identify protocols in your lab for cleaning evidence and work surfaces. We often think of how do we clean the phones? We may even realize that I need to clean the table after the phone's been laying on there. Something that was interesting to us, we had to realize we have to clean the tools even. If a tool's been exposed to a bloody phone, how do we clean the tool so that it doesn't have risky bloodborne pathogens on it? Ensure your teammates are being careful. If you develop a pattern in your lab that if someone that it's okay to say, hey, remember your gloves or where's your eye protection? In our lab, at VTO Labs, we take care of each other, because in the busyness of the moment, when we're so focused on that digital evidence, just the gentle reminder from a colleague can help us make sure that we protect ourselves. If you're testing new ways to clean devices, don't do this on evidence. This is one of my biggest pet peeves. And if you ever hear me speak anywhere in the world, you'll hear me say on all kinds of topics, do not practice on evidence. If you need to test something, if you may be testing a new way to get data off, or you may be testing a new solution to decontaminate devices, we don't do this on evidence. We have to do it on sample devices so that we don't in any way alter the evidence. And this is just a good reminder when you're thinking about decontamination. And lastly, you need to have a plan of what to do before these devices show up in your lab. You may go into work tomorrow morning and somebody shows up with a device that's covered in who knows what. And so you need to have the plan in place before these devices come to you. Why is that important? You need the right PPE. You need your employees trained on how to clean the devices. You need the right decontamination supplies before it gets there. So if you don't have a plan, stop, realize that this is something important, and make a plan for how your lab can be ready. How do we clean electronic devices? This is a question that we receive so often whenever we're talking about the work we do in damaged devices or decontaminated devices. And this takes me to a really key principle. Whenever we're encountering a new problem, the first thing we do is we turn to the science of what does the science say. And for digital forensic practitioners, we often encounter a new situation and we think we need to figure out how to solve this. You know, we'll put our heads together as digital forensics people and we'll think, how are we going to come up with the right solution for this? Sometimes the answer may have already been solved in a different scientific discipline. And so my encouragement to you is to go back and if you'll see the bottom of that slide, what does the science say on this topic? Is there other information that's already out there that may inform this question of how do we clean electronic devices in this context? Cleaning devices is already solved, and this may be new information to many of you. But what you don't realize is that the very last step of electronics manufacturing is cleaning the printed circuit boards and assembled devices. So every phone that we've ever touched, every computer, every tablet, the last step of manufacturing is, as they brought it through the manufacturing process, is they clean it to remove the excess flux that's on this device, any particulate that's there. So as it goes out as a new device, it has the highest chance of functioning correctly and not being a return, to that manufacturer. So how does the manufacturing industry clean devices? If you go to Google and you search PCB, so printed circuit board, assembly, cleaning, you will see, on this one Google image that you see on the screen, 102,000 videos on printed circuit board cleaning. So again, I point out to you, this is a problem that's already been solved. There's an entire industry that caters to the manufacturers on how to clean devices. As we think through this problem a bit further, we can start to see industry standards that are on this exact topic. There's an industry standards group called IPC JDEC, and they guide the processes that manufacturers use on making devices. And on this is J Standard 001, the requirements for soldered electrical and electronic assemblies. You can see that section 8 of this actually talks through how to clean the devices and what's appropriate for it. If we look even further, even the manufacturers can often provide direction on what to do. And this is a Texas Instruments PDF that I found on a specific chip that they provide. And you can see here, it walks through exactly their recommended guidelines on how to clean the printed circuit board assemblies. So again, I mentioned to you, this is something in digital forensics. I've seen all sorts of things that people have tried. They've tried household cleaners, and they've tried other things that a friend told them. This has already been solved by people that make the devices. And if we use the expertise they have and bring this into our practice, it will increase the ability that we have to do this correctly. If we look, the electronics industry, their process can be summarized in these very simple steps. Is that when we have a device that's dirty, the very first thing that we do is clean it, then we rinse it. If it's not clean enough, we clean it again, we rinse it. But probably the most important step that people miss on this is drying it at the end of this process. One of the questions I frequently get asked is, what do you clean it with? And the electronics manufacturing industry has a number of different chemicals that can be used to clean circuit boards and clean chips. And by just doing a quick search on that, you can identify chemicals that can be used for this very process of cleaning devices. Drying is important because when liquid is introduced onto an electronic device, the liquid may have the ability to conduct electricity. So if you have liquid on the surface of the device, if you have it absorbed into the printed circuit board, you have a risk of a electric short circuit unless you dry that according to the guidelines that have been set up in the IPC JDEC standards. Cleaning devices is already solved. This is not something that we have to try to solve. It's already been figured out. And what have we used it on? At VTO Labs, we've used this process that you see on wet devices, on dirty devices. We've used it on burned devices. We've used it on devices that are risky, and we just don't know what's on this device, but we want to make sure that it's clean and safe to handle. So this is a proven practice in the electronics manufacturing industry, and I'm telling you, as a digital forensics laboratory that focuses on these hard problems, we use this process over and over every day with tremendous success on devices that we encounter in our lab. Now, I know what you're thinking. If you go to your chain of command in your laboratory and say, "I have a new idea. We need to wash devices before we touch them," it's going to be hard in a lot of our law enforcement agencies to help them understand why this is important and why it even works. This is why we can point to existing standards that are out there, show them that this is how the manufacturers do it. You can also practice this on devices that are not evidence, because remember, we don't ever practice on evidence. And then lastly, we're always here as a resource if you have questions or need additional information on this specific topic. What about biohazardous devices? So this is all interesting. Steve, we started talking about biohazardous and devices that are contaminated at the beginning. You've shown us how that we can clean these devices. Does this work on things that have been exposed to Ebola or chemical weapons or other sorts of contaminants, fentanyl, methamphetamine residue? Let's talk about that specifically. And the important thing, this photo, my title is messed up a bit on this slide. This photo that you see on the screen right here is what drove us to find a solution to this problem. We do a lot of, at VTO Labs, we work a lot in the fringe areas, damaged devices, contaminated devices, new technology devices. And what you see on the screen here is it's an evidence bag of pacemakers that we received. We were trying to get pacemakers to see how we could pull the data off of the pacemakers, and is there data on the pacemakers that could be relevant to investigations. We received a set of pacemakers in, and all of them had been post-mortem. They had been taken out of people after they had passed away. And when we looked into this bag and saw these pacemakers with blood and flesh on them, I realized we didn't have the right processes in place to clean this kind of material. And it made us go and find a solution so that we could keep our lab team safe. What is that proposed solution? Again, what does science say about this topic? We as digital forensic practitioners can say, we'll just go figure it out and solve it. Has anybody already solved this though? That just by slight tweaks to the process, we can make that work for our digital evidence area. We settled on a particular, I'm really unhappy with the way the slides are goofy on the screen. I apologize for that. The thing that we found, there are solutions out there on how to decontaminate biohazardous material. We saw that earlier when talking about bloodborne pathogens. The problem is that none of these had been tested on electronic devices. And so what we did is we started looking at the possibilities that are out there for decontaminating devices. And we started to try those on test devices to see, can we decontaminate the device without harming it and without damaging it? We settled on a particular decontamination formula that was created at the US National Laboratory called Sandia Labs. And this particular decontaminant was designed for full spectrum biological and chemical weapon decontamination. They were trying to create a solution that could kill things that had been exposed to biological weapons. It was made to clean environments. How could you clean a room? How could you clean equipment that had been exposed to it? But it had never been tested on electronic devices. So we thought this was a great candidate. It kills all sorts of things that are bad. Will it work on evidence without damaging the evidence? And I'm happy to tell you we have found the solution. The solution that we have found, it works on bacteria and spores, viruses. It works on the chemical weapons you see listed on the screen. It works on narcotics, methamphetamine residue, other kinds of contaminants. The two things that we frequently get asked is, what about fentanyl? Yes, it cleans fentanyl. And we often get asked, what about COVID? And it has been found to be successful on the virus, the SARS virus that causes COVID as well. So this is a very broad spectrum decontaminant that cleans devices that have been exposed to damaging contaminants. The thing that's really interesting is that we have tested this on lots of devices. We have tested this on computers. We have tested it on phones, USB drives. We have tested it on drones. We have tested it on chips, CDs, DVDs, and in all of these scenarios, it does not damage the evidence. By taking the industry process of clean, rinse, dry, and applying this decontamination solution, we're able to kill things that are harmful to laboratory personnel without damaging the evidence. We at VTO Labs, we've created 3 solutions based on this so far. We have a contaminated device transport kit. So if you have evidence that has been contaminated, identified on scene as contaminated, we have a kit where you can start the cleaning process even before it gets to the laboratory, so that it makes it safe for your digital forensic practitioners to handle. We also have decontamination chemicals that you can use in your lab. You don't have to send this to VTO Labs. You can do this right in your laboratory, wherever you are, to go through the safe process of decontaminating devices. We also have training on decontaminating biohazardous devices. So we have an online training, walks you through the exact process that we use in our lab to address these kinds of devices, so that you can have the same level of success that we do. I'm seeing a question. I see lots of questions. Let's hit a few questions. You want to? So the first one that I see, wouldn't it be better to utilize PPE only until the device can be decontaminated? Yes, I think the PPE the PPE risk that you see, the risk that you're trying to avoid, is best suited to have PPE on until you know the device is contaminated. In our laboratory, we still would wear gloves just because it's a practice that we want all of our teammates in. So we would still wear gloves at a minimum. But once the device is decontaminated, you'll see us start to pull off the glasses or pull off the respirator, take off the other PPE, because at that point it is would be considered safe to handle. Another question is rubbing alcohol good enough to decontaminate? And the evidence that we have seen by searching this area is no. Rubbing alcohol is not sufficient. And another IPA or isopropyl alcohol is what's commonly used. In our laboratory, we would use isopropyl alcohol up to 99% concentration. This is lab grade chemical, and it still is not effective at cleaning all of the different decontaminants that you could be exposed to. And my question to you is, if this is not good enough to be used in a hospital setting, if they're looking at other kinds of decontaminants with a high alkalinity, if they think it's not good enough for my team to make sure it's safe for them as well. Are you aware of any disposable gloves that are touchscreen compatible? No. This is my best friend when I'm wearing gloves, a stylus. And that's what I typically use, is that it's just easier to pick a stylus up than pulling gloves off to interact with it. And I can clean the stylus. I can also replace them when the end of it is not working. Best way to find prices for the kits on your website. If you reach out on the website, you can request a quote. They get a bit of information of quantity and what you're looking for and can help you with that. Are there specific resources out there you would recommend to look for those answers? That's probably, I don't know where that was in the context, Christopher. If you have some additional detail on where that was in the presentation, I can speak to that. I'm sorry I missed that earlier. I'm curious how you clean off unwanted matter without removing evidence such as fingerprints. That's an excellent question. And our guidance to the laboratory teams that would be dealing with this problem is that you should process your trace and wet forensics first. All of even if you weren't using decontamination solutions, what we as practitioners need to do to devices, we may need to open the devices up if something that needs to be repaired. And there's ways that we may be introducing additional sorts of, not contaminants, but even biological material that we want to avoid. So my recommendation for all laboratories is do your trace and wet forensics first, before you have it to the digital evidence people who need to clean it. One investigator used over-the-counter scrubbing bubbles to decontaminate a cell phone and electronics inside. The phone had been with a buried dead body. Solution worked. Is scrubbing bubbles part of your toolkit? Excellent question. And this is a great example where as digital forensics people, we often are trying to find that solution. And we have heard of using scrubbing bubbles. We've even used scrubbing bubbles in our lab before. The interesting thing about scrubbing bubbles is I always want to know, I don't care what the name on the label is. I want to know why it works. And the thing I would call out about this particular product is that this does not decontaminate devices to a level that if you handed me a phone that has hepatitis on it and I can choose between scrubbing bubbles or something that I know kills it, me and my team are going to use what we know kills the bad things that may have encountered. Decontamination only goes back to log kill. Alcohol only has a certain log kill, while VTO venom is a 7 log kill. I'm not following that exactly. Thank you, Jamie. Let's see. Next one. Decontaminating a device can be considered a workplace health issue with OSHA, but it removes physical evidence. Would the effect of regulatory OSHA guidance be subordinate or potentially detrimental to statutory requirements of federal evidence that may be presented at the local or state levels? Jesse, this is a really interesting question that's US-centric. One of the interesting things, if you're in a federal lab, I would encourage you to talk to your workplace safety personnel to see if the OSHA guidelines relate to your specific laboratory practice. The solutions that we're proposing here, if you had to go up against the defense attorney and they said, what do you mean you washed this device and rinsed it and dried it? You have solid science to stand on of showing them, here's the electronics industry standard that says this is the way to clean devices. You also can point to other regulations that say we need to decontaminate these devices to make it safe for handling. But the third point that I would say about that is that the decontamination processes that I'm describing to you do not damage evidence. If you follow these precisely of clean, rinse, dry, you will not damage the evidence. The data is still in the device and the data can still be retrieved from the device. We have done this on hundreds of devices, all different kinds of devices with all different kinds of things they've been exposed to. Can you provide contact information where we can request a copy of the slides? Yes. Let's see what we have left on the slides quickly. What else is coming? I mentioned what we have so far. Contaminated device shipping cases is one of the areas that we're looking into. We showed you a transport case that can easily move it from the crime scene to the lab. What if you need to ship it cross country? We're working on that now. We have some ideas and prototypes that we'll be sharing on that. You can follow the website to get more information. Another thing that is coming, a decontamination station for your laboratory to contain the cleanup. You don't want, if you're dealing with devices that have been exposed to bad things, you don't want this spread all over the laboratory, and the ability to constrain it to a specific area that you can easily clean up after is something that I think will be important in a lot of our laboratories. Lastly, if you need help on this, if you need consulting for us to come alongside you, help to draft those processes on how you can do this in your lab, that's something that we're available to do as well. Questions? I see a few more here. Let's hit those. Can you please share how you go about drying devices? Excellent question. We follow the IPC JDEC standard on drying devices as well. The IPC JDEC standards say that circuit boards should be dried at 90 degrees Celsius for 24 hours. And if you have individual spare components, those should be dried at 120 degrees Celsius. So if we're drying just a chip that we think has gotten wet, we would dry it at 120 degrees Celsius. We dry that in a convection drying oven in our laboratory, and any device that's ever been wet for any reason, if it was a quick drop into a lake or the ocean, or if we ran it through a cleaning process, we always dry the devices according to the IPC JDEC standards for 24 hours before we touch that device, because we want to make sure that we're not introducing the potential for electrical short circuit. As a defense forensic person, would you follow the same procedure to protect ourselves? Yes, and I don't, for defense there, I'm not sure if that is prosecution versus defense or if it's talking about defense forces, but if you are dealing with evidence anywhere in the world that may be exposed to biohazardous conditions, prosecution, defense, if you're in the military or defense forces, absolutely you should be following these same protocols to keep yourself safe and your team safe. Are you using ultraviolet light for decontamination? We are not. The broad spectrum of contaminants that we encounter, ultraviolet is not sufficient to kill all of those kinds of things. And so we want to have a simple solution that the entire team knows how to follow. There was some, I know in the beginning of COVID, people were examining using ultraviolet light to clean evidence. And I think there is science to back that up as well. But if we have a solution that works on the virus that causes that, as well as all these other things, we'll just default to a single solution that we know works consistently well. Do these solvents affect internal batteries of the devices? What about affecting LCDs? Excellent question. So we have a hard line in our practice at VTO Labs that if a device has been exposed to liquid, we do not use the battery again. The problem that we encounter, we know how to dry components of phones, we know how to dry printed circuit boards, we know how to dry chips. There is not a safe way we've identified to dry batteries to ensure that they're completely dry. So in our practice, what we would do is either use a DC power supply to provide the battery necessary to power it, or that it may have specific electronic componentry, like a drone, we would get a second battery to power that, noting serial numbers and such in case you're thinking on those terms. But we would not use, we never use a wet battery in our practice because we don't want to introduce a short circuit. LCDs is a great question. At VTO Labs, we have a device library of almost 1,000 devices that we can use for testing. And so we know that LCDs, it's a bit of a mixed bag. If you clean them, rinse them, in some instances, the LCDs will not work again. And in that situation, we would use a donor screen because our laser focus as digital forensic practitioners, we're interested in the data and how we can get the data off the phone. We're not a repair shop. We don't care if the original screen works again, if it's consumed as part of this process, or if we need to use a donor screen to get that data off, we will. So batteries, definitely I wouldn't. The LCD screen, it really depends on the manufacturer if it's affected, but I would be prepared to use another device if needed. Just for a final screen, thank you for your time today. I appreciate, I was so excited to see the names from all over the world that I know that are joining and all the different countries that join. Thank you so much. You can see a link on the screen if you'd like to understand more about our decontamination. And you also see my email there. And really, I mean it. Don't hesitate to reach out. If you have questions, if there's some way that we can be of help to you, we want to make you, give you all the resources you need to be better at what you're doing wherever you are in the world. So thank you for your time today. I don't see any other questions, so I hope to see you again sometime soon. Thank you.